The TMJ TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ TMD Demystified podcast.
Hi, everyone. I'm Tony Urbanic, and we are here gathered together today to talk about the next edition of TMD Demystified. Welcome, and I appreciate your attendance and look forward to speaking with you, and actually look forward to you learning something about TMD. As I mentioned on multiple places on previous podcasts, I have a lot of experience with TMD over the past 40 years. I'm not going to go through it now, but both in training and 30 years of doing surgery on the temporomandibular joint in the past 10 years, focusing my efforts on the problem of TMD in a non-surgical direction. I encourage you, if you are interested in actually demystifying the whole project and problem, to start out with our first installment, our first edition of the podcast, and start from there. I try to keep the titles and the material in somewhat of a logical sequence as I bring you up to speed and understanding the problem, both from a patient's point of view, a technical point of view, a treatment point of view, a marketing point of view, and with a great attempt to simplify it and not to complicate it in the many methods and ways in education that is currently out there, both surgical and non-surgical. That's my goal, that's my statement, that's my purpose. But today's topic is quite simple and I think fairly easy to present to you, and that is I am going to present a typical TMD patient. I've had the opportunity over the past couple of years with the intent of eventually getting to recording for the public, recording for my colleagues, in one form or another, in this case, a podcast of typical and exemplary patient interviews and patient consultations. I've had the opportunity to record probably about 200 of these consultations already, and I have many to pick and choose from. I've only recorded, or at least kept the best ones. That's the 200. I've probably recorded twice, 2 or 3 times that many. Many I've just discarded because they were too typical. I've kind of recorded the ones that I thought were helpful in education, that proved the point, that showed the method, that showed the way to actually do whatever we're trying to describe. In this case, I just kind of randomly went through those couple that I thought were typical consultations, which showed a patient with the typical symptoms, the typical responses, and especially I want to bring out the typical method that I use for doing a consultation, because after 10 years of honing my skills and listening to patients and taking them through the entire process of history, examination, diagnosis, and then explanation and treatment, in my way, I have it down to a mechanical science, a simple way to do it. I am sure there are hundreds of other ways. And depending on your personality and your background, you may want to totally change anything that I present here today, but I present it as a very good way to obtain the information you need in the most expedient and successful way to use that information to make your diagnosis, the bare bones, which is simple. You don't need fancy x-rays, you don't need machines, you need a good knowledge of the problem, a good history taking, which is very duplicable. Is that a right word? Duplicable, being able to duplicate it well. and then application of the knowledge and education to the patient, which does several things, which we'll go into. But we're only going to actually hit the first part of this today, which is the way that you take your history and get the information that you need before you do your very simple examination to then either make or discard your diagnosis of TMD. So we're just going to hit one patient today. Her name is Rachel, and I am going to show you 6 minutes and 18 seconds, the first part of this consultation, which goes over the patient's history, how they present it, and how I ask them to present it, because you can get wound up in these patients talking for 30 minutes, 45 minutes easy if you just let them wander wherever they want to go. Of course, your time is very valuable, and that is the reason one of the reasons that I picked out a patient to indicate how simple it is to get the information without excessive amount of time. And then we'll do the rest of the full consultation, which would be the exam, confirming your diagnosis, and then most important, educating the patient. We're not going to have time to do that today. We will do it on another podcast. But for that, just want to concentrate on the bare bones of what you need to know to get your information and get on with an examination. So let's just go to this particular interview with this patient, and then I'll have plenty of comments about it afterwards to lead you to what I have to present, why I think it's important. We are gathered here to talk about your chief complaint of severe TMJ pain and nerve pain. Take your mask down, and we're going to talk here. Age 30, come from Hickory, Old Hickory. Glance at your x-ray. Fair enough.
I was in the ER yesterday. I woke up yesterday with, I couldn't move my jaw at all. Like, it hurts up here, like in the way back. It feels like there was a cut, and like it started bleeding when I woke up, and it was just agonizing, and the headache. This has been a whole week of the worst it's ever been.
Well, let's get a little history from you. What I want to know from you, Ray, is a little bit about your history, how long this has been going on, and your symptoms. Okay. I'm not so interested in what anybody else told you about this, did about it, recommended for you. I want to know about your symptoms and the history.
Okay. Well, I guess it started probably my teeth grinding 8 years ago, really bad, and that started to irritate I had a lot of clicking and a lot of, it was really just the uncomfortable of the clicking and the noise, but then it started to have pain about 2 years ago, where it's in my jaw and my ears, and I started to get nerve pain up in here and in the back, and they were thinking it was like neuralgia, but I think it's definitely related to my TMJ. And then within the last week, it just got severely much worse. I don't know if it's stress that I'm grinding more or if that's correlated, but last week it was this side, really bad. Like I could barely eat. It felt like it was out of place. My bite isn't right. And then I yawned on Friday, and it popped back in, and I could chew again. And then I was good for 2 days, and now it's this side, and since Sunday it's been agony.
Okay. All right, any more to your story? All right, I got some questions for you.
Okay.
But before I give my question, just one other thing I want to get. So how many doctors have you seen for these symptoms over the past 8 years? All the symptoms, how many kinds? You know, I don't need names, I just need to know about how many.
7.
7. A few dentists, a few ENT doctors.
A few PCPs, yeah, I've done it all.
All right. All right, so I got some questions for you. Fill in the blanks, okay? I want to know what other symptoms you may be having or had that are associated with this. I'm going to run down a list of about 12 items. Question will be, do you have now, currently, recently, or ever meaning ever, had the following symptom? If you've had the symptom, your answer will be yes. If you have not had the symptom, your answer will be no. But if you had the symptom, I'm not interested in what anybody else thinks about that symptom, their opinion about the symptom, their diagnosis on the symptom. I just want to know, have you
I
had
like
the
you. Straightforward.
Yes,
Okay.
ma'am. I have a great reputation for being straightforward.
Okay.
So here's the questions. And some of them I know the answer to, but we're going to do the whole list. So do you have or have you ever had frequent or recurring headaches?
Mm-hmm.
Do you have or have you ever had frequent or recurring earaches, or something that feels like a deep earache?
Uh-huh.
One or both sides?
Both sides.
Do you have or have you ever had pain that goes down the back of the neck, side of the neck, or forward into the jaw?
Yes.
Is it neck pain, jaw pain, or both?
Both.
One or both sides?
More on my left.
Well, more on the left tells me actually both, because it's more on one side and also on the other.
Yeah.
Correct?
Yeah.
All right. Do you have or have you ever had problems with ringing in your ears? Do you have or have you ever had a problem with fullness in your ears, like you've been swimming and can't clear your ears?
Mm-hmm.
Do you have or have you ever had any problem with dizziness, vertigo?
Mm-hmm.
Do you have or have you ever had any problem with shoulder or arm pain, or shoulder or arm tightness, right here? One or both sides?
Both sides.
Do you have or have you ever had any problem with arm, hand, or finger tingling or numbness?
Left side.
To your knowledge, do you clench or grind your teeth?
Yes.
And how do you know that?
I wake up. I catch myself doing it during the day, even when I'm like, stop it, and I still do it. I can't stop.
Okay. And have you ever had any trauma to your face or your jaws? This would be something substantial. This isn't kickball in high school.
No.
This would be any kind of motor vehicle accident. All right. Now, after watching the patient give her information, the questions I ask, I want to emphasize how I go about doing this. It isn't obvious, and it's visual, you just saw it. But here's the thing. I have kind of 4 parts to doing a full consultation. Step 1 is to walk in the room, introduce myself, and most importantly, sit down and listen. Step 1 is listen. But when you listen, you want to guide the patients before you just sit there and let them go on about their history and what Aunt Molly has to say about it and what 3 other doctors had to say about it and what they saw on the internet and what they think themselves might be the problem and how many doctors they went to, and that isn't what you want. What you want to hear is just what their symptoms are. And so, at the beginning, I usually sit down and listen, but I emphasize that I just want you to give me your symptoms, what your symptoms are, what you want fixed, what's going on with you. I don't need to hear what other doctors have to say about it or what else you think about it. That's step 1. Sit down and listen with a little guidance. And then step 2 is to go down through the symptom list with the patient, because they in their explanation may have already given you several of these symptoms. So you check them off mentally, and then step 2 would be to again go down through the symptom list that are well accepted, well known, to find out how many of these symptoms your patient has experienced. And that's the second part of the video that you just watched. And at the end, the last question may not be quite obvious to you, but that is the first 4 symptoms, the most common symptoms, no doubt about it. Headache, earache, jaw pain, and neck pain. Those are the big 4. The most frequent symptoms. The most common symptom of TMD is headache. The second most common symptom of TMD is neck pain. The third most common symptom is ear aches, ear pain, and the 4th most common symptom is jaw pain. From then on down, it gets less frequent. We have a lot to say about the sequence, etc., but the big 4 are headache, earache, jaw pain, neck pain. And to that, I always ask this question: which one of those 4 symptoms in your recollection, in your history, goes back furthest? And the reason that I ask that question has a couple purposes behind it, but the big purpose is to drive home to the patient how long their symptoms have been going on, and also to give me that information, how long their history is with TMD. And you will find easily that in most cases, it goes back very, very far. Most often to adolescence, with the females, most often to adolescence, 14, 15, 16 years old. High school is most very common, middle school, but in that age group is when the females will first start complaining of headaches, frequent and recurring and severe headaches. Headache is the most common answer. But that is the reason I asked that last question, because it gives you a framework to build into the patient their understanding of the problem, because they experienced it. They experienced it for many years. And whether it be they experienced for 8 years or for 40 years, they're the ones who are well knowledgeable about these symptoms. And to be able to drive home to the patient that you're talking to that you are familiar with the symptoms, that number two, they are definitely related to TMD, and that their problem had been going on a long time before they one way or another filtered into your office for a solution, for the solution, which is unloading the joint with the urbanic device and the protocol, using the protocol, because it's a tool. The device is a tool. If you know how to use it, you will get the result. So that's the first point I want to make about the video that you observed, and to drive home the fact that the history is very easy to get. You want to make sure that you check off those symptoms that the patient acknowledges they've had, because you're going to use that symptom list not only in confirming the diagnosis, because history and symptoms are just red flags. You have a series of red flags. Differential diagnosis, it's just a symptom among many symptoms. Of course, when you add a series of symptoms that all direct to the same diagnosis, that's encouraging that you're going in the right direction. But symptoms do not make a diagnosis, as I'm sure you know. Of course, a lot of patients think they can make a diagnosis with symptoms, but no, if you have bad headaches, does not mean you have migraines. You have bad headaches. If your shoulders hurt, this does not mean that you have neck problems. It could mean that you have TMD. But the point is, symptoms do not make a diagnosis. They're a series of red flags that lead you toward the direction of the diagnosis. And in almost all cases, the examination that coincides with these symptoms will then either confirm or dissuade you from making that diagnosis. So again, in the video, you heard me go through that symptom list one after another. And in this case, the patient, Rachel, had almost all of these symptoms at one time or another. The other point about doing this, besides getting you the material you need, is as you go through this list, very often the patient's eyes will start to get wider and they'll go, do you mean, or they will sometimes say, do you mean, or they'll think that my shoulder pain has been associated with my TMJ problem? And you go, likely, or if you're sure of it, yes. And what that does, it starts to build confidence. Because as I've talked about before, the majority of patients that come in to see you, whether they know anything or have heard anything or been exposed to any kind of other information about TMJ, one way or another, the majority of these patients are very skeptical. Why are they skeptical? Because they've been told one thing, to do one thing or another that does not work, that does not help, whether it be from a friend, from the internet, from a medical or a dental provider. And because of that, and because their knowledge of that, they become very skeptical or even jaded regarding talking to anyone and listening to anyone who thinks they know anything about TMD. And so you're dealing in the most part with a bunch of skeptical patients. It's okay. We already discussed previous podcasts about skepticism. Skepticism is all right. It's a good thing to have as long as it's not abused, and as long as you know how to deal with it, what you're dealing with, and whether it's good skepticism or bad skepticism. But the point is that now that you've gone down the list and you say those symptoms are typical symptoms of TMD, now it starts to make sense to the patient. So that is why it's important to get a very good history, list of symptoms, and then go into the third part of the consultation itself, which is the exam, which we'll cover later. And then the fourth part is education. Education can be divided into several parts. Number one, the description of inflammation and why that is responsible for all of the symptoms. You go into that because of, again, educating the patient and building confidence in the patient that you know what you're doing and that they have hope that their problem can be solved. A description of how the device works, why separating the posterior teeth over a longer period of time, using a protocol carefully, will be effective. The outline of the protocol, and what to expect with results. Exactly what you can expect when you do this protocol. And after doing thousands of cases, I'm in the position where I can pretty much explain to the patient what they can expect, when they can expect it, exactly what they can expect. And again, when you do that, and then further, weeks later, when all this starts to play out like you described at the beginning, the level of confidence in you as a provider goes through the roof, which is one of the things you want to do. You want to build confidence with your patient and have confidence from the patient, which leads to successful outcome, happy patient, and dissemination of the information to other people who may need it, who do need it, who in some cases desperately need it. So I'm going to leave it there for this presentation, for this edition. I'd suggest that you, if you're really interested in doing this for your practice, that you take the time to review that video again after reviewing my comments, and look at it again from a fresh point of view as to what you're doing, why you're doing it, and the information you want to glean from the patient and how you're going to use that information. Again, there's nothing helter-skelter about why I present to patients, how I talk to patients, or even how I'm presenting this to you, the observer of the podcast. I try to be effective in my communication. So I'm going to wrap it up with that today. I encourage your comments, your questions. I encourage your participation. If you, as a provider, as a dental provider, general dentist, orthodontist, oral and maxillofacial surgeon, would like to become a network provider to use our device and protocol for the benefit of your practice, definitely for the benefit of your patients, we can be found at www.tmjservices.net. You can communicate with myself or our Director of Marketing at Tony at tmjservices.net, or Naomi at tmjservices.net. And I look forward to speaking with you again in the near future and giving you significant more data on how to accurately, effectively, and extremely successfully treat TMD. Talk to you soon.